there would be no GraceMed if it weren't for Tomasa Gonzalez and Rachel Rubalcaba. And they came to me and said, do you have a space, a couple of rooms that we could use on a maybe weekly or every other week to see expecting mothers? And I took them up to the third floor of St. Paul's Educational Unit, and they said, these rooms are fine. And they began seeing young mothers there at St. Paul's.
It was just really a time where there were a lot of needs, and that's why we started other programs to minister to food needs and the housing needs and employment needs. The problem with going to some of the medical services that were available, especially for the Hispanic people, a lot of them were undocumented, and so they were very fearful. I give a lot of credit to Chuck Chipman and the ladies that were working with him to try to address that need. A lot of credit to Martha Sanchez for coming in and helping organizing and putting it all together.
They were Spanish speaking, so many clinics had no capability of giving them care because they couldn't speak to them. Secondly, they had no insurance, so all of their medical care had to be provided outside of what little money they could pay. Obviously, they could not really pay for medical care. I can't imagine how sad it would be for parents to see their children sick and have no place to go.
I think what was really most important with this clinic are two words: trust and relationships. People immediately got to know us on a first-name basis in a very respectful way. They knew that they could trust us, that they could confide in us, and tell us things that I don't think they would ordinarily just tell anyone.
And at the time, it was really an answer to the beginning of the spread of the HIV virus, because there were so many places in that victims of that virus couldn't get health care at all. And one of the things they did was establish a dental clinic, and it was really the only place in the state where HIV positive persons could get dental care.
Bilingual people, especially in leadership roles, were very few and far between. Martha Sanchez could relate and be in ministry.
If you couldn't pay, then that was fine. But often if you could, then people would give us $5. And often they wanted to give something.
We were trying to meet their pharmaceutical needs out of donated medications. When the grants came in, it was wonderful to actually write a prescription and believe that in 6 months the patient could be continued on the same medication. It was wonderful being able to do diagnostic exams.
The rise of the HIV epidemic had brought the onset of the OSHA issue, and so we began to try to get OSHA standards set up for the clinic as well. So during the time that I was there, I wrote the policies and procedures for the clinic to kind of try to bring them into the current age of healthcare. Over a period of time, we got a lot of people on what was then called the Indigent Drug Program.
And we knew that there was a need for ongoing medical care to this population. And a Hispanic Ministry Task Force was formed with various members of the different local churches around there and other community members. We reached out to Wesley Family Practice. We reached out to Wesley Medical Center also. And we began to make plans that as we were going to address those medical needs, that we needed to have physicians. And Wesley Family Practice agreed to do that along with their interns, their residents. And so the clinic started once a evening on Tuesday evenings there at St. Paul.
It slowly grew, and it became to the point where we needed to send people out to hospitals to get hospital care. And so St. Joseph and St. Francis and Wesley Hospital, all three agreed to take some of our clients. Carolyn Pyburn and her husband Marvin Pyburn had returned from the mission field, and they came to see me and shared that they would like to continue their missionary work, but they didn't want to have to be responsible for all the medical insurance and the administration and things that would have to be going on, and asked if we would be interested in having them come and work for us. We had outgrown the 2 rooms that we had there at St. Paul, and we decided to move the clinic down to the Cathedral Apartments. Sandra Parker, Lyons, who was working for me at that point as my assistant director, and so I asked her if she would take over and run the Pyburn Clinic. When the Pyburns came, it was just a godsend because Carol and him together worked. They'd worked all their married life together. They were good working together, and Carolyn was kind of the organizer, go-getter, doer, and Marvin was the service provider. And then with Sandra taking over and helping do a lot of the legwork, then that left Carolyn where she could focus on helping in a nurse capacity.
We saw her as the person who kept us going financially. So obviously great, she was the person who did the hiring. But just on a more daily basis was the person we'd go to and say, we've got a problem, fix it.
Oh, the need was tremendous. We grew by leaps and bounds, and we had to keep expanding staff in order to fill the need. And we started 2 or 3 days a week and ended up going full time. And we also expanded to other areas. For instance, in Hutchinson, Dr. Pyburn went over there 1 day a week. We never turned anybody away.
I think we were just becoming aware of the large homeless population, and just several years after I came, we started with the homeless grants. But we are also aware of a fairly good number of undocumented people that weren't speaking English as a first language, and began to be concerned about their care.
The move came about because we were able to get some funds from the United Methodist Health Foundation, Health Fund, and so we were able to do some remodeling. We had one part of our building which is primarily a garage storage area, and so we took that area and made it into the clinic. It was a larger space, nicer space. We were able to have an exam room for dental and for optometrist. We had a separate room for drugs and things that we needed. Had a nicer waiting area, reception area. I think we had 5 or 6 exam rooms that we could keep people going, because I think at that point we had 2 physicians working with us.
I came to GraceMed in 2004. My mother-in-law, Addie Matson, was the prescription assistance staff person at the time. She's the one that told me that there was an opening for an executive director. The first days were very difficult because we had significant debt that we still owed. So really the first step was really surviving, to try to find the financial means to pay off the debt, to have some foundation of stability, and then to begin hiring people that would come and really enhance the ministry and really provide the quality of care that we desire to provide. I naively approached the people at Via Christi to see if they had a different facility that we potentially could lease from them. And Sister Helene Lentz, who at the time was the chairman of the board of Via Christi, is a person that I connected with. She told me to come over here and look at a building at 1122 North Topeka, which has become our Helen Galloway Clinic. We moved in January of 2006. 33,000 square feet of space that's been remodeled over the years. I think every square foot of that clinic we've touched to update in terms of facilities. But as I look back at some of the key success factors, if it had not been for meeting Sister Helene and the cooperation of the people at Via Christi, we would not have had that facility and not been able to begin to grow as we have in those early years. We knew places like Plainview and Oak Lawn and northwest Wichita had lots of low-income housing areas with a lot of children that needed access to health care, but they were a long distance away from the private practices that were located either on the east or the west side of town. And so that's really what led to our vision to expand beyond just one or two locations, but to have multiple locations that would be easily accessible to people that lived in those areas.
The school-based clinic concept that was sort of Healthy Children Clinic was sort of the beginning of that, has been a real good concept for GraceMed. And now we have, I don't know how many school-based clinics, and I think the city could use a few more, as a matter of fact, and may continue to get some more of those because it's such a good idea.
In July of 2016, when we were asked to come to Topeka and assume responsibility for the federally qualified health center in that community, you know, to have the kind of community support all the way from Shawnee County throughout that organization or throughout that county was just fantastic. And they certainly were serious about wanting to expand services in that community. They felt like GraceMed was the best option to select in order to come into the community and meet more needs of the people that live there. Being invited by the people in McPherson to come and establish a clinic there, there was an opportunity the community identified, and they asked us to be part of that. And then more recently, which I think is going to be a benchmark for the future, is to assume responsibility for a physician practice in Clearwater, Kansas. We know that rural Kansas is hurting for physicians. Many are retiring, and then new physicians, many do not want to relocate in a rural area. And I feel like our experience in Clearwater may very well pave the way for future efforts to go into rural communities.
As I watch this all happening, it just seems like a natural procession of people coming to the clinic, and the clinic become known by its care and ability to minister to people without health insurance or without adequate ability to receive care, and then to watch it move to other towns and outreach ministry. It's been exciting to think that all began in 2 rooms at the top of St. Paul's Education Building.
I think about undocumented people who were able to have healthy babies because of what we did with prenatal care and deliveries. And I know for a lot of the other people with chronic illnesses, I know we impacted their lives.
I think the important thing that we just never can lose sight of is that our goal is to provide quality health care for people that come to us.
To see GraceMed to expand the way it has, I thought, God is still working in the midst of all of us, putting the right people in the right places that has this compassion and love to serve those who are in need.
And I think that's the secret. Most of the volunteers that we had, and even the doctors that came after Dr. Pyburn, were people who had a heart for those in need. And Dr. Knisley, who took Dr. Pyburn's place, eventually became a missionary because of her experience at the Pyburn Clinic and her heart for serving other people.
Before coming to GraceMed, I had very few thoughts about what happens to someone who doesn't have insurance. GraceMed obviously plays a significant role within any community that we're in to make sure that people do have access to affordable, high-quality health care. I think we have relieved a lot of ER visits from the hospitals. We know that it's just not the right place for people to go for primary care as to their emergency room. And so I think we've done a wonderful job of offloading that demand from hospitals to a clinic. But we can do so much more. There's still so many people out there that are uninsured in the state of Kansas because we haven't expanded Medicaid yet, that need care, need affordable care, and it needs to be something that we continue to advocate for.
As the clinic started 40 years ago, it was a mission. Churches saw it as a mission project. And what's very unique is that GraceMed remains as a mission clinic. With the word grace and med, we know that it's through God's love and compassion that reaches out in ministry by providing health care, Medicare, by many who are able to show the care and the love that's given by our Lord Jesus Christ. Thank you, GraceMed, for being there.